today we're celebrating the launch of a collaboration with ourselves at Vision Care for Homeless People and Specsavers.
Together we're looking to create a brighter future where no one is left behind and everybody has access to the vision care they deserve.
We're hoping and we're working very hard on the fact that homeless people can have access to eye care and new glasses if they need them.
Over the last sort of 10 years plus, Specsavers have been supporting us quietly in the background with pieces of equipment and supporting new clinics and things like that. And now we're going to have sort of a bold move forward, and we currently have 7 clinics throughout the country, and with the collaboration with Specsavers we're aiming to get to 24 clinics in the next 5 years.
I've been with them and watching them for some time now, and I think it's very good. We're in communities, and I think it's looking after people in the community. Very important nowadays. You only have to read the newspapers to know how difficult it is for people to find somewhere to live. So there's more and more people becoming homeless, and at least the one thing we can do is look after those people and make sure that they have the eye care and new glasses should they need them.
VCHP are going to be providing us a service in Bristol. So this is basically the launch pad for that. And that's a really important relationship for Specsavers to have, because there's a whole thing around inequity. I think that there's a clamour to talk about inequality. But obviously, if you don't deal with the inequity to begin with, then everything is always going to be unequal. There's always going to be that inequality. And I think that's a relationship that Specsavers and Vision Care for Homeless People are going to be working on primarily, is ironing out the inequity of what's happening.
We find that in the last 20 years that only about a third of the homeless people that we see through our clinics are actually eligible for NHS general ophthalmic service sort of eye care. The other side of things is homeless people actually often find it more difficult to actually go into a high street practice because it has a very high retail look, or they may feel embarrassed about not having a contact address to actually give. So there's that barrier as well. So even if they are eligible for NHS eye care, they may not know it and they may not feel comfortable going into the practice. So from our side of things, what we do is we actually take the clinic to an environment that people actually feel comfortable, welcome. So what we do is we set up our clinics within a homeless day centre. We actually have a full practice, and it's a fixed practice, the same as you would get on High Street. It has all the normal equipment, so your test chart, field screener, slit lamp, and basically you're aiming to provide that same eye care service in an environment that they're comfortable and happy with.
I think the aim is to cover the country. It's like all things, small steps. Anybody can actually do this, and it's a matter of setting a system that makes it easy for those people. So a little bit of staff training, I'm sure, inside stores, inside practices, but it can be done, and I think it's something we should do.
We also work on advocacy. What we would love to have is NHS general ophthalmic service eye care is available to all homeless people, regardless of whether they are on a medical benefit or a financial benefit. We think it should be available to everybody at that point of service. If that was achieved, then effectively the eye care could be delivered through every practice in the UK. So I think we have the capacity, and from the optometrist side of things, and having had 20 years working with sort of hundreds of volunteer optometrists, we know that there is the will to do that, but we actually need that sort of financial structure and the sort of the will from the NHS to deliver that as well.
Okay, we know there's centres that people can go to and they can have various healthcare, including with their eyes, but I want to make it easier for people to visit an opticians like anybody else.
And let's just be really brutal about this. Healthcare and disadvantaged groups haven't always been on the same playing field. You know, there's a whole lot of stuff around no ID. You haven't got any ID, you can't get seen there. There's stuff around prescription costs and stuff like that. So what we look for is we look for examples where people who are disadvantaged can get access to one good, positive interaction. The hope that I've got for this is that positive interaction already comes through VCHP, but VCHP are very limited in their size. The relationship they've got with Specsavers now is going to expand that fivefold. Now that obviously will give more people the opportunity to have that positive engagement. And from there, it's easier to encourage people to start engaging in other areas of their health. And that's the key. If you give people an ongoing relationship where it's all negative, 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 then they disengage. So we want to take this as an opportunity to get people engaging, even if it's at vision care level, looking at optical care, and for that engagement to be positive.
We shout from the rooftops about getting your glaucoma checks and all this sort of business, but we don't want to leave out a part of our community who haven't got access into a bricks and mortar building, so to speak, and it should cover everyone. Definitely, the word is everyone.